What if the biggest problem with numb feet isn't the tingling itself, but what happens when you stop moving because you're afraid of it? Many people with neuropathy become less active, sit more, avoid stairs, and stop walking. Over time, their legs can become weaker and their balance less reliable. But you don't need to begin with a difficult workout. Simple movements from a sturdy chair can help you practice leg strength, joint movement, coordination, and balance. Today, I'm going to show you 5 simple exercises that can be performed while seated or with chair support. Imagine Linda, a 68-year-old woman with numbness and pins and needles in both feet. At first, she ignored it. Then she stopped her evening walks. Soon, standing from the sofa became harder, and she started holding furniture while walking around her home. Nothing dramatic happened to Linda. Her world simply became smaller. This is something people with neuropathy can experience, not just discomfort, but reduced confidence in movement. The goal isn't to ignore neuropathy. It's to keep your body safely involved in the movements you can still perform. Neuropathy can have many causes, including diabetes, certain medications, nutritional deficiencies, chemotherapy, alcohol-related nerve damage, and other conditions. That's why exercise isn't a universal cure. It's one possible part of a broader plan that should also address the underlying cause of your symptoms. Think of your nervous system like a communication network. Your feet send information about pressure, position, and movement to your brain. When nerve signals become less reliable, your brain may receive incomplete information. That's one reason someone can feel unsteady even when their muscles are still reasonably strong. Movement gives your brain repeated opportunities to practice coordination. But remember, these exercises don't magically repair damaged nerves or replace medical treatment. If your symptoms are new, rapidly worsening, one-sided, or accompanied by significant weakness or other concerning symptoms, seek medical evaluation instead of simply exercising through them. Start in a sturdy chair with both feet flat. Keep your heels down and slowly lift your toes upward. Then lower them. Repeat 8 to 15 times. This works the muscles around your ankles, which help control how your feet meet the ground. Keep every repetition slow and controlled. With neuropathy, some people gradually change how they walk because they don't fully trust their sensation. They may take shorter steps or lift their feet less. Seated toe lifts give those muscles regular practice. If the movement causes pain or unusual symptoms, stop and ask a healthcare professional if it's appropriate for you. Sit tall with your feet underneath your knees. Slowly straighten one leg until your knee is comfortably extended. Pause, then lower it. Switch sides. Start with 8 to 12 repetitions per leg. This works your thigh muscles, which are important for standing, climbing steps, and controlling your body during walking. If you avoid movement because you're worried about falling, your leg muscles can gradually become weaker. That's called deconditioning. You don't need to make knee extensions exhausting. Use a comfortable range of motion and start with fewer repetitions if necessary. The goal is simply to keep your leg muscles participating. Sit comfortably with both feet on the floor. Slowly slide one heel backward underneath your chair, then slide it forward again. Switch legs and repeat about 10 times per side. This encourages controlled movement through your knees and hips while keeping you seated. Mobility doesn't only happen during walking. Your hips and knees need regular movement too. When people become sedentary, stiffness can gradually develop, making everyday movements harder. Keep your movements comfortable and controlled. If your chair has wheels, don't use it. Choose a sturdy chair on a non-slippery surface. Place both feet firmly on the floor and sit tall. Gently shift your weight toward your right hip, return to center, then shift toward your left. Keep your feet planted and the movement small. Try 8 to 10 shifts in each direction. Stop if you feel dizzy or unusually unstable. Balance isn't just about standing on one foot. Your body constantly makes tiny adjustments to control your position. Practicing these adjustments while seated gives you a gentle way to work on body awareness. For people who have become afraid of movement, small controlled exercises can be a useful starting point. Sit near the front of a sturdy chair with your feet about hip-width apart. Lean slightly forward, push through your feet, and stand. Pause, then slowly lower yourself back down. Don't drop into the chair. Start with just 3 to 5 repetitions, using your hands for support if needed. Sit-to-stands are especially useful because standing from a chair is something you do every day. If you need to push heavily with your hands, It may indicate that your leg strength needs attention. Don't try to prove how strong you are. Progress gradually, with the goal of making everyday movement easier and more confident. Now think about this. Which daily activity has neuropathy affected most for you? Walking? Getting out of a chair? Using stairs? Or simply feeling confident while standing? Tell me in the comments, not just the symptom, but the activity you miss doing comfortably. Before starting a new routine, especially if you have neuropathy, diabetes, significant balance problems, or a history of falls, speak with your healthcare professional. Ask what exercises are safest for your level of sensation, whether you need physical therapy, and whether medications or another condition could be contributing to your symptoms. If you have reduced sensation, inspect your feet regularly. You may not immediately feel a blister, pressure point, or small injury. Checking your feet can help you notice problems early. And remember, you don't need a gym or intense workout to make progress. Sometimes progress simply means moving with a little more confidence. A man named Robert started with only 3 sit-to-stands because that was all he could comfortably manage. He didn't suddenly regain perfect sensation. Instead, he became more consistent, added short walks, and continued his seated exercises. Eventually, he noticed something important. He wasn't thinking about every single step anymore. His confidence improved before his symptoms completely changed. That's an important lesson. You don't have to wait for perfect sensation before rebuilding confidence in movement. Start with what you can safely manage and gradually build from there. Small improvements can still make a meaningful difference in everyday life. Today, we covered 5 simple movements: seated toe lifts, knee extensions, heel slides, seated weight shifts, and supported sit-to-stands. The goal isn't to cure neuropathy. It's to keep your muscles, joints, coordination, and confidence involved in daily life while you work with your healthcare team on the underlying cause. If this video helped you understand neuropathy differently, share it with someone who has been avoiding movement because they're afraid of falling. And tell me in the comments which everyday activity you most want to feel confident doing again. Your answer could help someone else realize they're not alone. This video is for general education and isn't a substitute for personalized medical advice, diagnosis, or treatment. If you have neuropathy or another medical condition, speak with your doctor or qualified physical therapist before beginning a new exercise program. Stop if you experience pain, dizziness, unusual weakness, or other concerning symptoms.